Did Robert F. Kennedy break a promise he made in order to get confirmed as health secretary? On Monday, Kennedy unexpectedly dismissed every member of the Advisory Committee on Immunization Practices, known as ACIP. When RFK Jr. was trying to secure his confirmation, there was one Republican senator that he had to win over, and that's Bill Cassidy of Louisiana. Cassidy is a physician and a strong supporter of vaccines. During RFK Jr.'s confirmation hearings, Cassidy strongly challenged some of Kennedy's past assertions about vaccine safety. But ultimately, Cassidy voted to confirm Kennedy to HHS, saying that he received some commitments from RFK Jr. about protecting vaccines, including this one.
It confirmed he will maintain the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices recommendations without changes.
ASIP is a committee of health and medical experts who make recommendations on the use of vaccines in the U.S. Picking his own replacements to the advisory panel would give Kennedy the ability to make significant changes to the government's vaccination recommendations. Joining me now is my new colleague, Chelsea Ceruzzo. Chelsea covers the Department of Health and Human Services in RFK Jr. for STAT, so she's the perfect person to unpack all of this with. All right, Chelsea, thanks. We actually haven't met yet, so I guess we're not wasting any time with collaborating here, so thanks for taking the time.
Yeah, excited to be here.
So, yesterday, Senator Cassidy was asked by a reporter if his firing of the entire advisory committee kind of amounted to a broken promise. What did he say?
So he disputed that exact framing, right? I mean, this was him speaking in the hallway, so it was a pretty quick exchange. But what he said was, I was promised by Secretary Kennedy that he wouldn't disrupt the process of ASIP, not necessarily disrupt ASIP, which is that independent panel of vaccine experts. And of course, listening back to his comments made in February, that is actually what he said. He spoke on the House floor after voting to confirm Kennedy, and this came after weeks of him being a little unsure, given his own experience as a doctor. So, as he said, Secretary Kennedy has promised not to change the process of vaccine approval. And technically speaking, he hasn't quite yet, but he has dismissed the entire panel. So that could be read in one way as him disrupting the process.
So yesterday in our STAT Slack chats, when this news broke, everyone immediately said, oh, where's Bill Cassidy? Why is Bill Cassidy the first person that comes to mind when RFK Jr. is in the news?
He was the key vote to confirm Kennedy to this role. He is the chair of the Senate Help Committee, which was the committee that ultimately voted to confirm the HHS secretary. And in the weeks and days leading up to Kennedy's confirmation, Cassidy was very clearly conflicted about this decision. He is a doctor himself, and repeatedly during these confirmation hearings, he disputed some of what Kennedy was saying about vaccines. At one point, Kennedy referenced a study regarding vaccine safety that Cassidy actually pulled up during the hearing and read, and later said this study has a lot of problems. So Cassidy really was the defining vote. So for him to vote yes and then say there are all these caveats that led to me saying yes was a huge deal. And part of him agreeing to this was with this agreement from Kennedy that he would not do X, Y, or Z, or he would include Senator Cassidy in a lot of his decisions. So part of the question is that happening? Cassidy did say yesterday he spoke with Kennedy twice. It's unclear if that was before his op-ed came out in the Wall Street Journal where he said he was dismissing the panel or after. But Cassidy has said the two of them are in touch, but has not really said what those conversations are like.
Does Bill Cassidy have a disproportionate amount of influence over RFK Jr. as opposed to other senators?
I think his role certainly as the Senate Help Chair, that is the committee that really oversees a lot of HHS programs. So when HHS wants to do these things, like for example, Kennedy is doing a reorganization, they really need to get the Senate Help Committee on board with it to get them to agree to push forward policies or money that would allow him to do the things that he wants to do. And Cassidy, again, is the chair of that. So it's really his decision when to bring Kennedy in, when to bring certain issues to the committee. So certainly in a way, the two of them are really meant to work very closely. And again, Cassidy did say back in February that they would be working closely, and all these decisions would come through him, including hiring decisions, including policies around vaccines. So in Cassidy's words, yes. But again, in practice, it's hard to tell.
And since then, has Senator Cassidy been forthcoming about what his relationship with RFK Jr. is like?
He has said that they have a relationship and that they have spoken, but he has rarely given any details on what those conversations are like. Again, when I'm up on the Hill and you see him in the hallway, I've asked him about these conversations, and as have other reporters, and he has always declined to comment on the specifics, calling them private conversations. He also hasn't necessarily weighed in on whether or not he is pleased with the direction Kennedy is going in, and how he feels about actually casting that crucial vote. So he's very tight-lipped in that regard. Of course, we reached out to his office and asked for calls and interviews, which have not come together yet, but yeah, it's unclear.
And what's the reaction been in Washington?
So in terms of public health experts, there's been a lot of concern about this move. This has been, in some view, the most drastic action that Kennedy has taken so far on vaccines. And again, as we know, Kennedy has spent years sowing doubt about the safety and efficacy of vaccines. Of course, coming into the role, he said he wasn't going to take away vaccines. He just wanted to make more data available. But since he's become secretary, he has taken these steps towards, making. He's taken these steps towards continuing to sow doubt around vaccines. And again, with ASIP, his reasoning is that he wants a clean slate. He wants to start over, but it's unclear who is going to be the new leader. So there's definitely a concern in the public health world. As far as Republicans on Capitol Hill go, I spoke with a couple of them yesterday. Senator Susan Collins said it seemed excessive that to get rid of everybody, and she said she wanted to know more about the decision, and she would have concerns about that. Again, Cassidy had said in a tweet that he had been in touch with Kennedy and would make sure that he wouldn't necessarily put people on the new panel that might sow further doubt in vaccines. Again, that remains to be seen. But I think overall in the public health world, at least, and among Democrats, there's definitely a lot of concern that this is a move to discredit vaccines.
But despite Kennedy and Cassidy both maintaining that this wasn't a broken promise, Robert F. Kennedy Jr. has broken some promises in his role as health secretary so far. Is that right?
Yeah, and I think the biggest example was very recently, Kennedy, alongside his FDA commissioner, Marty Makary, and his NIH director, Jay Bhattacharya, announced that the CDC would no longer recommend COVID vaccines to pregnant people and, I believe, healthy adults. This, of course, is a break from the CDC's ACIP recommendations, which do recommend the updated COVID shots every year. So again, this would have been a decision normally in the process made by ASIP. However, it was made by Kennedy and Makary and Bhattacharya. So that is a big example.
Later this month, there's supposed to be a meeting of ASIP, but we don't at this point even know who's going to be comprising ASIP. So what's that going to look like?
Yeah, that's right. So at the end of this month, there will be an ASIP meeting, which has been scheduled, and HHS says remains on the schedule. At that meeting, they will be considering recommendation votes on vaccines, including COVID, RSV shots. I believe mono is also on there. So, no, I'm sorry, mono, meningitis. But yes, so we don't know who's going to be voting on that, but that's just in a matter of weeks. So we should know fairly soon who is going to be attending that meeting. And of course, we're looking into that now.
Do we have any idea, or is there any speculation of who Kennedy is expected to appoint to ASIP?
Not yet. That's something that here at STAT we're trying to chase down. Of course, we won't give any tips on it, but it's certainly something we will be looking at because we have no idea.
Thanks so much to Chelsea. Hope everyone at STAT's been treating you all right. And now for a little housekeeping, as they say. This is actually the first video in a new weekly series from STAT. Every week, I'll be going behind the scenes of the biggest STAT stories, explaining important topics in the healthcare space, doing dispatches from the most important events in life sciences, and talking to some of the foremost experts across the areas that STAT covers. So please like and subscribe if any of this sounds interesting to you. It's a little click, but it's a big deal for us. So we'll be back next week. I promise it'll be a good one, and hope to see you then.